Welcome to Greater Good Radio Hawaii, where leaders inspire leaders. Greater Good Radio Hawaii is dedicated to social entrepreneurship. I'm your host, Evan Leong, and with me is my co-host, Carrie Leong.
Thank you, Evan. Today's guest is Bob Hiam, President and CEO of Hawaii Medical Service Association, a nonprofit mutual benefit association which provides healthcare coverage to more than half of the state's population. Hiam is also involved in several community organizations, including the Blood Bank of Hawaii and the Children's Discovery Center. He is also chairman of the board for the Pacific Health Research Institute. Please welcome to Greater Good Radio, Bob Hiam. Welcome to our show, Bob.
Thank you, Carrie. Thank you, Evan. It's a pleasure to be here.
Could you tell us a little bit about HMSA?
Well, HMSA was founded in 1938, and it was really a community movement. It came out of a meeting of territorial social workers that was basically looking to start a prepaid healthcare system. And if you think about that back that time, it was right towards the ends of the Depression. And this sort of prepaid movement started on the mainland, but this was the first one that was consumer-driven as opposed to hospital or physician-driven. So it was from that just sort of it built and was successful, and in the 1940s became affiliated with Blue Cross and Blue Shield. So we are the Blue Cross Blue Shield plan of Hawaii. While we are a not-for-profit charter, we do pay federal taxes and operate, like most businesses would, but basically providing health care primarily through businesses. We do have about 5% or so of our membership individual plans, individual people that buy the plan, but mostly through large groups and small groups.
How did you get involved with the company? What's your story for that?
Oh, okay. I graduated from the University of Hawaii in December of 1969 and thought it would be good to get a job. It was either that or probably I grew up in Montana, go back and work for my dad in the electrical business. And so I went into the University Placement Center, and there was a job for a management trainee at this place called HMSA. So I wandered in, and after a couple weeks of interviews, and they hired me, and so I started basically in the claims department as a management trainee.
You've been with the company since then?
Since then.
Wow. And did you ever have your sights on higher management?
Yeah, I probably did. Initially, it was don't lose this job, work hard, learn the business, show them what you can do. And it's an interesting business, and I just had opportunities. HMSA was growing, adding business at the time, and I believe that being in the right place at the right time has a lot to do with things, and I think I was there and just sort of worked up through levels of management and levels of responsibility.
So what were the various job positions you've had in 37 years at the same company?
Oh, that sounds long. It started in the claims department, basically learning the basis of you figure if you're an insurance company and health business, processing claims is your core business. So learn that. After about the first year, the state contracted with us to take the Medicaid program over. And so I ended up as the supervisor of that. And that was probably the best on-the-job training. It was like, okay, the contract signed October 1st. We're going to start December 1st. Probably need 15 people to start out with. We can take maybe 5 or 6 from existing staff, go hire 9 people. And at that point, they seem like they're alive, they breathe, bring them in, and we'll train them. And then it was a very exciting time to build that up, to build new systems, put that in place, build the staff, and do that in a public program where the contracts with the state, where there's constant auditing and looking at what you're doing. So it was a real training ground.
Through your experience with HMSA, did you ever think that you may leave or eventually come back, since you did enjoy the company? And the reason I ask is it seems nowadays a lot of our generation, we kind of hop from company to company, although we are having good experiences at where we are.
Yeah, I think when I first started, and at that age, I was 22, you never think, I'm going to go into this company and I'm going to stay forever. I've got a job now, and then I'll decide what I really want to do. And then you progress, you like the company. You like the people you work with, and before you know it, you got a 5-year award, and then you've got a 10-year award, and then pretty soon you got a 35-year award. But I know what you mean, because talking to younger people, it's like, oh yeah, I've been there 37 years. You couldn't get a job anywhere else, and basically it's like it's hard to understand that you would do that. But if you like the people you're working with, I'd say majority of my friends are coworkers. And you like what you're doing and what your company stands for, time goes fast, and I've never regretted not trying anything else.
And have a lot of your colleagues also been there for, a while like you?
Yeah, there's it's a good mix, but there's a real core of people. There are people that started right around the same time I did, that are colleagues, and people that I, hired when I first started, and I was young. And they're starting to retire. I'm thinking, well, wait a minute, because I'm not quite ready for that. But there is a lot of longevity there.
Thanks for tuning in. Stay tuned for more on Greater Good Radio.